What does an individual or family do when their income is too much to qualify for Medicaid, but they can't afford to purchase a health insurance policy or pay out of pocket for basic health care? In many places in our country, the options are limited, but in the Salt Lake Valley, there exists an oasis of free medical care for low income families and individuals, the Maliheh Free Clinic. The Maliheh Free Clinic is the medical home for 6,000 low income, uninsured individuals and families in our community. All the clinic patients are low-income families earning below 150% of the federal poverty guidelines. These families have no health insurance, nor are they eligible for Medicare, Medicaid, CHIP, or homeless services. Has been well documented that poor people suffer higher rates of medical morbidity and premature mortality and receive disproportionately less medical care than their affluent counterparts. The Maliheh Clinic focuses on primary and preventative care, but also provides family practice, pediatrics, gynecology, dermatology, podiatry, ophthalmology, surgery, and dentistry, serving an average of 85 to 100 patients each day. The Maliheh Clinic has 8 full-time staff and nearly 400 volunteers. The full-time staff consists of the executive director, the front desk staff, laboratory technician, head physician, and charge nurse. Volunteers consist of physicians, dentists, physician's assistants, nurse practitioners, mental health counselors, nurses, phlebotomists, interpreters, patient techs, medical assistants, nurse educators, and office assistants, along with support from 3 AmeriCorps Vista volunteers serving in program planning, patient navigation, and development. The mission of the Maliheh Free Clinic is to improve the quality of life in the greater Salt Lake area by providing free medical services for uninsured and low-income individuals and families to help reverse the cycle of poverty and suffering created by poor health. As a 501c3 charitable organization, the Maliheh Clinic relies on federal grants, private donations, and the generosity of many institutions, including the University of Utah and others, to provide the array of services it does. Opened in 2005 by emergency room doctors and nurses who saw the need for free health care for the working poor in our community, with financial support from the Khosrow Semnani family. Khosrow Semnani had a humble beginning in Iran as the fourth of 7 children, pictured here with his family. He arrived in Salt Lake City in 1969 and received a master's degree in engineering administration from the University of Utah while working as a janitor. The clinic is named after his grandmother, who taught him compassion and the value and need for giving back to your community. One of the larger goals of the Maliheh Clinic is to offer hope to people who might otherwise have little. To quote U.S. Navy Vice Admiral Adam M. Johnson, Jr., "Hope is the essence of what fires our souls and provides light in our world. Hope becomes a beacon that shows us the way from darkness and desolation to light and life." The Maliheh Clinic attempts to help people once again become healthy and productive members of society and thereby change that person's impact from negative to positive. There are cracks in our healthcare system so big that entire families can fall into them. If your household income is more than 130% of the federal poverty line, your family won't qualify for Medicaid. However, affording a high deductible policy might be impossible. In 2010, the Affordable Care Act expanded Medicaid insurance for people with low income in 31 states, but Utah wasn't one of them. The legislature of Utah decided not to expand Medicaid, but failed to address the problem that the federal government was attempting to alleviate. Even if you can afford a high deductible policy, you still might not be able to afford the out-of-pocket expenses, which can be as high as $5,000 a year or more. Filling this massive crack is the Maliheh Free Clinic. The importance of the Maliheh Free Clinic is evident in the faces of those that are served there and those that serve there. If the state of Utah decides to expand Medicare, it's possible this clinic would be obsolete, but that wouldn't faze the executive director, Jeannie Ashby. "Feel free to put us out of business," she jokes. Thank you.